Hi, this is Chandrashekhar Yavagal from Yavagal Foundation, and I'm here to tell you something about the Pink Smiles initiative which we have launched in collaboration with Aissel Technologies. So what exactly is this Pink Smiles initiative and why is it that we have launched it in the month of April? April is Oral Cancer Awareness Month. This is a very important month for us because we intend to create awareness about this cancer, which is very important for we Indians. How do I say that? I say that because, just to give you a perspective, more than 1 lakh of Indians have lost their lives to the COVID pandemic since the last year. Now, if you take the statistics for oral cancer for the last 10 years, you will be astonished to note that every year, nearly 77,000 Indians die due to oral cancer. That's why it is a very important disease for us, and we have to create awareness to make sure that we safeguard our countrymen against this dreaded cancer. So what causes oral cancer? As Indians, we are genetically more prone to catch this disease, and we are more likely to get it if we have any of the habits like alcohol, smoking, pan, gutka, chewing tobacco, so on and so forth. And if we switch on any television, we see our celebrities endorsing various kinds of products, which doesn't help the matter either. A lot of our youngsters and college-going students mock them. You hear celebrities talking about Bolo Zuba Kesari, which is not cool at all, because we have no idea what that Kesari Zuban can do to our health and do to our oral cavity. So these are the kind of things which we should actually avoid. Chewing tobacco in any form, smoking in any form, these are the ones which are more likely to make us prone to oral cancer. Plus, it could be a faulty dental appliance which keeps irritating the oral mucosa. It could be a sharp tooth, a wisdom tooth, a cusp of it which keeps irritating the tongue. These are some of the risk factors for developing oral cancer. Of late, there has been a lot of talk about exposure to human papillomavirus. Even that is a risk factor for oral cancer. Plus, consuming a lot of colored foods adulterated with a lot of chemicals also makes us more prone to oral cancer. So what's the way out? Prevention is the way out. We all understand that once a patient is diagnosed with cancer, we cannot add more days to his or her life. All that we can try and do is to add more life to his or her remaining days. So prevention is the key, and early screening is the only way how we can prevent oral cancer. Now we have a 5-minute non-invasive, completely non-surgical, painless scan available to diagnose a disease like oral cancer even before it actually shows up as a lesion. Yes, it's called as blue diode fluorescence. What happens is that when we use a blue diode over the oral mucosa, if the oral mucosa is healthy, we get a healthy green glow on that scan. Unfortunately, if there is any dysplasia or if some cells are not in an oxidized state, it appears as a black hotspot. So it's as easy as this. It takes hardly 5 minutes, and we can predict the risk of any person catching this dreaded disease almost 2 years before the lesion starts. So I sincerely urge all of you to take care of your oral health and undergo this screening. Thank you.